This is how some of you feel when we talk about doing your core exercises. Okay, we're not talking about sit-ups here. For you moms with back pain, we're going to do 3 very special, very specific for your needs core exercises that are going to help transform your back pain. Everybody knows the core has to be strong for you to have a healthy back. So I'm going to show you the 3 most important and easy to do core exercises. Here we go. This one is called the Pilates 100. You're going to bring your knees up so that they're just slightly ahead of your hips and your legs are going to be parallel to the ground. Then we're going to lift our heads and then just flap our wings. We're going to do that 50 to 100 times. Now remember, core exercises are best done before a Taco Bell run. You wouldn't want to do these after a bean burrito. For you moms that have recently had C-sections, we're going to start a little bit easier, so I don't want you doing these at home if you've had a C-section in the last 2 months. And I haven't been keeping count, but you will, and you're going to go up to 100. See how that's so much better on your back than trying to do crunches or V-ups. Okay, that's not what we're doing. Those V-up type exercises, those crunches, are not how the spine actually works. The spine stabilizes, it holds you in place so your arms and legs can move. So that's number 1, the Pilates 100. Number 2 is a modified plank. It's really easy to do planks wrong, and if you have back pain, planks can sometimes make you worse. So I'm going to teach you a modified plank that's almost foolproof. Hard to do this one wrong. You're going to be on your hands and knees, and you're just going to lift your knees up in the air. The goal would be to hold for 30 seconds to a minute. Shaking is normal, it's actually desirable. You're going to feel your arms work. Obviously, you're going to feel your quads work, but the core muscles will be doing a lot of good for you. Okay, and your last one here is called the bird dog. You're going to lift an arm and an opposite leg. The most important part of this exercise is lifting your guts up towards the ceiling. And you're going to hold for about 10 seconds. Come back, touch your knee to your elbow, and come back for about 10 seconds. Constantly resetting, lifting your guts up towards the ceiling. Keep your neck out of this position, okay? You don't really need to look forward. Look down, tuck your chin, set your guts, touch. You're going to do that 3 times on each side, and then switch. Oop, reset. You don't have to reach up and reset. I'm just demonstrating. Okay, here's the wrong way to do this exercise. We don't need to be overarched. Low and controlled is just fine. Touch that elbow to your knee and come on back. Lift your guts. You're going to feel it here. You're going to feel it through here. You might feel it through the lumbar spine. You're going to feel it in the shoulders. It's a great progression. 3 very simple core exercises. If your arms are sore, mix it up. Do your planks first, Pilates second, bird dogs last. If your arms get tired or sore, then put the one in between that doesn't require much out of your arms. You're going to love these exercises. They're going to get your heart rate up a little bit, which is great. You should be doing these every day. You'll be sore, and if you need to skip a day or two, that's fine. And for those moms with stress incontinence, if you can't sneeze or go on a trampoline without thinking about a panty liner, then do a Kegel while you're doing these exercises, and that will enhance what you're doing with your core. Pelvic floor is an important part of the core. And so enjoy, comment if you have questions. Look forward to hearing how well you're doing with your core exercises.